Next. Assalamu alaikum and good morning. Over here. Today is the 7th day of physical curriculum. And let's start the session. Today's synopsis presentation of Dr. Irshad Ahmad, who is from Department of Muhammad. He will present on the topic. And often they have randomized paper trial, clinical study of phenol formulation, Banadicol Dazu, Sabat Alu, and controlled drug nitroflutide in the management of uncomplicated urinary infection, that is Tahi Alate Ball. So please, Dr. Irshad Ahmad, please come to the dais and share your thoughts about your synopsis presentation. Dr. Irshad Ahmad. Assalamu alaikum. फर्स्ट ऑफ ऑल आप सभी को मेरी तरफ से और डिपार्टमेंट की तरफ से तहे दिल से मुबारकबाद कि आप लोगों का सिलेक्शन हुआ और आप लोगों को मौका मिला और आपके जरिए हमको मौका मिला हमारा प्रेजेंटेशन पेश करने का। आज का मेरा टॉपिक है, मेरा प्रेजेंटेशन जो मेरे सिनॉप्सिस के ऊपर है। मेरे गाइड हैं डॉक्टर शाहनवाज अख्तर और को गाइड डॉक्टर नजीब रहमान सर, प्रोफेसर हैं हमारे डिपार्टमेंट में, और डॉक्टर रजी अहमद सर। मेरा आज का टॉपिक है an open label randomized control clinical study of urinary formulation Banadicol Wudu Sharbat Alu and controlled drug nitroflutide in the management of uncomplicated urinary tract Tadia Alat Bol. Need for the study. यूरिनरी ट्रैक इंफेक्शन को वर्ग हालात को भी कहते हैं यूनानी मेडिसिन में, जो करीब मॉडर्न मेडिसिन के यूटीआई के मुशाबे है। इसको वर्ग बताना वर्ग हड्डी बोलते हैं, क्योंकि इसके जो क्लिनिकल परसेंटेज है वो यूटीआई के सामान्य है, कंप्लीटली नहीं लेकिन कुछ मिलते जुलते हैं। The prevalence of UTI the prevalence of UTI is about 3% at the age of 20 years
increasing by about 1% in each subsequent decade. Between 1 year and 50 years of age, UTI and recurrent UTI are predominantly disease of female. In male, UTI is uncommon fracture in first year of life and in male over 60 years. एक्सट्रीम में इसमें वैल्यू होता है, लेकिन फीमेल में ये कॉमन है, और जो मेल में होता है ये कॉम्प्लिकेटेड कहलाता है, क्योंकि जब मेल में ज्यादातर प्रोस्टेट की वजह से होता है, बीपीएस की वजह से, और वो एनाटॉमिकल डिफेक्ट होता है, तो उसको कॉम्प्लिकेटेड कहते हैं, जो कि मेरे सब्जेक्ट में नहीं है। एक स्टडी की गई थी महाराष्ट्र में, उसमें ओवरऑल प्रेवलेंस मिला था 33.5% मिला था, और मेल में मिला था 33.2%, और फीमेल में 66.78% मिला था। एनाटॉमिकली इसको इसकी दो कैटेगराइज दो किस्म की गई है, लोअर यूटीआई और अपर यूटीआई। इसमें सिस्टाइटिस मेल है, बहुत मोर कॉमन है। और बैक्टीरिया की बात की जाए तो इकोलाई बैक्टीरिया की वजह से ये 80 से 90% पाया गया है कम्युनिटी अक्वायर्ड इन्फेक्शन में, और 30 से 50% नॉन कम्युनिटी अक्वायर्ड इन्फेक्शन में। जो करंट मैनेजमेंट है यूटीआई का, वो 100% मॉडर्न पे एंटीबायोटिक्स के ऊपर डिपेंडेंट है, और एंटीबायोटिक्स का साइड इफेक्ट और उसकी रेसिस्टेंस दिन ब दिन बढ़ती जा रही है। यूरोपैथोजन में जो इकोलाई है, उसकी रेसिस्टेंसी बहुत ज्यादा इंक्रीज हो रही है डे बाय डे, और नाइट्रोफ्रंटाइल लो रेसिस्टेंस जो उसका सबसे लो देखा गया है वो 5% है। एंटीबायोटिक का जो शॉर्ट टर्म यूज है उसके साइड इफेक्ट में लाइक नोजिया वोमिटिंग है, और लॉन्ग टर्म यूज की वजह से उसकी जो कॉम्प्लिकेशन होती है वो हेपेटाइटिस, पल्मोनरी फाइब्रोसिस, पेरिफेरल न्यूराइटिस और रीनल फेल्यूर तक ये इसकी कॉम्प्लिकेशन है। यूटीआई एक पब्लिक हेल्थ कंसर्न है, जिसका ओवरऑल कॉस्ट जो है 25 मिलियन है इस साल में। इट इज डिस्ट्रेसिंग एंड अपॉर्चुनिटी लाइफ थ्रेटनिंग कंडीशन, खासतौर से जब इसको इग्नोर किया जाता है और इसकी वजह से पाइलोनेफ्राइटिस की कंडीशन हो जाती है या किडनी डैमेज तक की नौबत आ जाती है, और therefore one urgent alternative treatment as there is a need to find out a drug from herbal source which is least toxic, economical, efficacious and promising for the treatment of urinary tract infection. Department of Madhya Government District Hospital Patna aims to conduct a clinical study for managing uncomplicated urinary tract infection using Unani formulation containing Baratakal Budur and Sharbat Al-Bari. This study will assess the ancient remedies, efficacy, safety, and cost effectiveness in treating uncomplicated urinary tract infection to contribute substantial result to global society, scientific community, addressing the pressing need for authentic alternative in UTI treatment with more authenticity. Review of literature. Urinary tract infection are the second most common infectious disease worldwide, which have become a major concern in public health system. Hypocrites writing about a disease that appears to have been acute cystitis said that the illness could last for years before either resolving or worsening to involve the kidneys. Thus the term UTI encompasses a variety of clinical entity, including asymptomatic bacteriuria, cystitis, prostatitis, and pyelonephritis. UTI is usually associated with multiplication of organisms in the urinary tract. It is defined by the presence of more than one organism per ml in midstream sample of urine. Also termed as significant bacteria. There are different types of UTI, including acute and chronic, maybe symptomatic and asymptomatic, complicated and uncomplicated, nosocomial and community-acquired infection. The UTI सिम्टोमेटिक डिजीज जब हम यूटीआई बोलते हैं तो उससे हमारी मुराद सिम्टोमेटिक डिजीज होती है हालांकि एसिम्टोमेटिक बैक्टीरिया होता है बैक्टीरिया मौजूद होता है लेकिन कोई सिम्टम्स प्रेजेंट नहीं होती तो तुरंत में आमतौर से इलाज की जरूरत नहीं पड़ती है cystitis symptomatic infection of bladder pyelonephritis symptomatic infection of kidney complicated or uncomplicated complicated में एसोसिएटेड सिम्टम्स होती है मतलब उसके साथ में कोमोर्बिडिटीज होती है खासतौर से जैसे मेल में मैंने बीपीएच बताया और फीमेल में प्रेगनेंसी वगैरह है डायबिटीज है इम्यूनोसप्रेसिव कंडीशन है और एनाटॉमिकल डिफेक्ट वगैरह upper UTI. Infection involving the kidneys like pyelonephritis is the infection of renal parenchyma. Lower UTI is a term which encompasses infection involving the bladder, prostate, urethra, like cystitis, prostatitis, and urethritis. Uncomplicated UTI occurs in people who have normal urinary tract life, while complicated UTIs occur as a result of anatomical abnormality of urinary tract that offset the flow of urine. There are some major risk factors for predisposing the UTIs, like female gender, especially because both color new sexual activities, the especially intermediate urinary catheter, instrumentation of urinary tract calculus, urinary tract stasis, incomplete bladder emptying, diabetes mellitus, immunosuppression, and dementia. Etopathogenesis in conventional medicine of UTI is complex, influenced by many host and biological and behavioral factors and by properties of infecting uropathogen like gram-negative and gram-positive bacteria and certain fungi are the causative organisms. The key event in initiating each step in UTI pathogenesis are adherence and colonization of organisms. It starts with contamination of peri-urethral area with uropathogen. These uropathogen colonize the urethra, then migrate into the bladder. After migration, there is again colonization and invasion of bladder mediated by flight. फ्लाइट बोलते हैं बैक्टीरिया के ऊपर के जो हेयर लाइन स्ट्रक्चर होता है वो फ्लाइट कहा जाता है. Adhesion in turn start to respond in bladder, including neutrophil infiltration, begin to clear extracellular bacteria. Some bacteria evade the immune system. These bacteria undergo multiplication by film formation. These bacteria produce toxic protease that induce host cell damage, thereby releasing essential nutrients that promote bacteria survival and essential to kidney. Typical feature of cystitis and urethritis, including abrupt onset of frequency of micturition, urgency, burning pain in the urethra during micturition, जिसको डिस्क्रिया बोलते हैं, suprapubic pain during after voiding, intense desire to pass more urine after micturition. Urine that may be appears cloudy and have unpleasant color, non-visible or visible anesthesia. Systemic symptoms usually slight or absent. However, infection in the lower urinary tract can spread to cause pyelonephritis. This is suggested by prominent systemic symptoms with fever, rigor, and mobility, hypotension, joint pain, and guarding. यूटीआई में जब भी अगर कमर में दर्द होता है और उसके साथ में फीवर विद चिल होता है तो ये इंडिकेट करता है कि पायलोनेफ्राइटिस मोस्ट प्रोबेबली हो सकता है. और सुप्राप्यूबिक पेन सिस्टाइटिस को only about 30% of patients with acute pyelonephritis have associated symptoms of cystitis and urethritis. Immunity system of medicine. Tadya Mazrabol is a term which has been adopted and used recently in Unani literature, but in classical Unani literature, this term does not exist such as. However, the clinical feature of Tadya Mazrabol are available under the different nomenclature like hair of the bone, burning micturition. The first written description of Varma ala Kapur was present in ancient Hebrew papyrus and recommended herbal treatment to ameliorate the urinary symptoms without providing insight into pathological mechanism of UTI. Although there is no description of any kind of microorganism by name in the ancient literature, but from the careful survey of Tibetan literature, it is evident that the Arab Christians were well conversant with the process of infection, which they named Tadia infection and Kukula, purification. Ibn Sina in his famous book Al-Qanun has mentioned the microorganism Allah's Khamisa. Hippocrates believed that the disease was caused by disharmony of the four hormones. Ali ibn Sina Majusi in Kamil Sana described Varma ala Tabor in detail and appointed the main cause of Varma ala Tabor was weakness of excretory function and inflammation on neck of urinary bladder. Hakim Azam Khan in Aksir Azam had described Varma Ala Tabol and classified into Varma Ala Tabol Har and Varma Ala Tabol Bahir. Bukrat in Usul Bukratia has described that the presence of caste in urine and foul-smelling urine indicates that the pathology is related to bladder. Razi in Al-Hafiz described it under the heading of Tafsirul Qur'an, Hirqatul. He also described the efficacy of Ma'ul Jabal in Varma Matana. Similarly, many Unani scholars describe Varma Ala Tawar in their famous book, Etiopathogenesis in Unani medicine. According to Unani scholar, cause of Varma Ala Tawar are disturbance in Asbab Sitta Zaruria and weakening of Tabiyat Mudabbira Badan. Alteration in Kamiyat and Kafiyat of Akhlaq provides several conditions for growth and colonization of microorganisms. Hence, the cause of Varma Ala Tawar is not the microorganism alone, but the disturbance in Asbab Sitta Zaruria, which ultimately leads to an alteration in Akhlaq. According to United scholars, when body is attacked by the microorganism, Uwat Mudabbira Badan is altered in various ways, like Akhlaq Mahmuda are eaten up by microorganisms, and their toxins are added in Akhlaq. Some other cause of Varma Ala Tawar are inflammation, abscess of urinary tract, blood and pus from abscess of adjacent organ. Pus contaminates the urethra. Acid and colonize the urinary tract similarly as in conventional medicine. Blood and pus from abscess of adjacent organ ran into the urinary tract when Varma Ala Tawar. Irrigation due to stroke trauma leads to Varma Ala Tawar. बार-बार पथरी के होने की वजह से भी यूटीआई होता है, उसकी वजह है इरिटेशन. Acute and normal humor, rare hot temperament of blood causes erosion of mucous membrane or urinary tract, thereby inflammation. हिद्दत की वजह से एक वजह है कि जो सफरावी मिजाज के होते हैं और सफरावी पिज़्ज़ा खाते हैं और गर्म मौसम में यूटीआई के चांसेस ज्यादा हो जाते हैं. Person having virus temperament is more susceptible to uncomfortable. Alteration in Mejaz leads to disharmony of four hormones which was mentioned by Bukrat over the Mudabbira Badan. Classification in Unani text. Varma Ala Tawar is divided into two, Varma Har and Varma Barik. Varma Har could be Varma Har, Safrawi and Dabbi. Varma Barik, it could be Varma Barik, Barnawi or Sodawi. Sodawi, sorry. Usul Ilaj. As per the literature of Unani system of medicine, in management of Tazi and other animals, the following Usul Ilaj is recommended. Anti-inflammatory, diuretic, or excretion of rotten humor, analgesic, antiseptic, antipyretic. Therefore, on the basis of above Usul Ilaj, compound product Banatatul Usul and Sharbat Alam are considered to be a novel combination for the treatment of cardiac and aims and objective of the study. Primary and secondary. Primary to evaluate the safety, efficacy of the purposed generic formulation in the urinary tract infection, to compare the result of urinary formulation and standard control microcontroller in respect of safety and efficacy, to provide a safe and efficacious and cost-effective drug from the harmless source for the management of urinary tract infection. Second objective, to evaluate the improvement of quality of life of participants. hypothesis, Malakutur and Sarvata alcohol may be effective material methods. Study design as open label randomized controlled clinical study. Sample size will be 60. Categorized into two groups. Group A और Group B. Group M में 30% रहेंगे और Group D में 30% रहेंगे. Group B जो है कंट्रोल ग्रुप होगा और ग्रुप A टेस्टिंग ग्रुप होगा. ड्यूरेशन ऑफ स्टडी 12 से 18 महीना. ड्यूरेशन ऑफ प्रोटोकॉल थेरेपी तो मेरा 14 दिन का ड्यूरेशन है जिसमें 7 दिन का कंट्रोल ग्रुप के लिए और 40 डेज के लिए टेस्ट ड्रग देंगे. Intervention. Try drug dose. Group में टेस्टिंग ड्रग को होगा paracetamol tablet twice a day with शरबत आलू 20 ml twice a day और 14 days. Group B में जो कंट्रोल ग्रुप में will be treated with standard control drug capsulitis 100 mg 1 BD orally for 7 days. Preparation and quality control. ड्रग हम मार्केट से खरीदेंगे. खरीदने के बाद में उसको इंस्टीट्यूशन में या एक्सपर्ट्स को दिखाने के बाद में उसकी वेरिफिकेशन करने के बाद में उसको अपने कॉलेज में ही प्रिपेयर करेंगे और जो मॉडर्न ड्रग इज पेट्रोल ड्रग को मार्केट से एडमिट खरीदेंगे. पैकेजिंग एंड स्टोरेज ऑफ ड्रग विल बी पैक्ड इन एयर टाइट कंटेनर स्टोर इन कोल्ड ड्राई प्लेस. Diet will be advised is mentioned in the classical Unani books for UTI like soft balanced diet with low fat and spices. So diet में एक फैक्टर इसका कॉन्स्टिपेशन के लिए हम मेंशन देंगे. कॉन्स्टिपेशन की वजह से भी इसमें बढ़ावा दिखता है तो ऐसी डाइट नहीं देंगे जिससे कॉन्स्टिपेशन. Subject evaluation. Subjective evaluation will be performed and recorded at the baseline, weekly, and after completion of drug schedule. Laboratory evaluation will be performed and recorded at the baseline or after completion of the drug schedule. Selection of the patient. Patient attending in GTCH, OPD, and IPD will be inclusively enrolled in the trial. For random selection, satisfying predefined following criteria. Criteria for selection of patient like criteria for diagnosis for uncomplicated UTI. Diagnosis will be made on the basis of clinical presentation and UTI symptoms score. And in urine culture and sensitivity test, symptomatic young women अगर 5 से ज्यादा % होगा तो symptomatic diagnosed persons कहलाएगा. Inclusion criteria में diagnosed patient लेंगे एज 18 से 65 साल की रहेगी. Patient willing to sign writing informed person to participate in trial. Patient presenting with typical symptoms of UTI like painful burning sensation, increased frequency of urination, urogenital epilepsy. Patient presenting with complaint of lower back pain and pelvic pain, blood in urine, cloudy and bad odority. Patient not taking any other drugs for uncomplicated urinary tract infection. Patient who are willing and able to understand and follow the protocol for the duration of the study. Exclusion criteria. प्रेग्नेंट एंड लैक्टेटिंग वुमेन्स को हम नहीं लेंगे क्योंकि हमारी जो ड्रग है वो फीमेल में सेफ नहीं है सेफ्टी। और दूसरी चीज है कि पेशेंट विद यूरिनरी ट्रैक्ट स्ट्रक्चर और एनी एनाटॉमिकल एब्नॉर्मलिटी और कॉम्प्लिकेटेड में चला जाएगा तो उसको हम नहीं लेंगे। पेशेंट विद डायबिटीज मेलिटस, पेशेंट विद हेपेटिक और रीनल insufficiency and malignancy, patient on immunosuppressant condition, patient with HIV or STD, patient resist to statin control drug like nitroprotein, patient who fails to give consent, mentally retarded person, bedridden patient, patient is less than 18 and more than 65 years of age, patient willing to discontinue the drug taking for the treatment of UTI, patient with uncontrolled hypertension, patient with cardiovascular complication. Withdrawal criteria: right of the subject under trial to withdraw from the study at any time during the course of the study. If the subject not wishing to continue, patient who fails to follow any significant adverse drug reaction and adverse events, any acute systemic illness during the therapy, non-compliant with the study protocol, failures to consume the drug. Assessment of Mizaj. Temperament of each patient will be assessed on the basis of classical parameters as does the Ashara at the time of enrollment of the patient. ये चार्ट है, इसमें हमने वाइटल्स को भी इंक्लूड किया है। पैरामीटर फॉर एवल्यूएशन: patient will be subjected to a rigorous evaluation in comparating a meticulous examination of their medical history, a comprehensive local examination, and a detailed analysis of subjective and objective parameters. Furthermore, the assessment will be extended to the scrutiny of the safety of the user, both pre and post study, ensuring a pro and holistic evaluation process. Criteria for the assessment of efficacy. Efficacy of the test will be evaluated on the basis of subjective and objective parameters. Subjective parameters permit dysuria, burning expiration, increased frequency of expiration, fever with chill and rigor, hematuria, pyorrhea, pain and discomfort in lower and suprapubic, pain in abdomen. These will be estimated on day 0, day 7, and day 14. Objective parameter will be used to assess the efficacy of test drug. Urine routine, microscoping में first cell, urine culture temperature, hematuria. These will be estimated pre and post treatment. Subjective और objective parameter में को हमने इसलिए दिया है कि हम दवा दे रहे हैं, हम उसकी efficacy देख सकें। दूसरा इसका फायदा ये है कि हम पेशेंट को ले रहे हैं, अब भी हम डिसाइड करेंगे किस पेशेंट को हमको लेना है, किसको नहीं लेना है। ये साइन सिम्टम्स होती है नॉर्मली, और ऑब्जेक्टिव में वो चीज है जिनको हम गिन सकते हैं। ये सबको हमने 4 या 5 चीजें का स्केल बनाएंगे और स्केल के मुताबिक इसका कुछ आगे मेंशन कर रखनी चीज। सब्जेक्टिव पैरामीटर्स में बेस्ट लाइन डे 7 डे 14 पे फीवर, डिस्यूरिया, फ्रीक्वेंसी, हेजिटेंसी सबको मेंशन करेंगे और उसके बाद में उनका ग्रेडिंग बना के स्कोर निकालेंगे, तब हम रिजल्ट निकालेंगे लास्ट में। Assessment of safety. Safety parameter will be assessed by monitoring adverse event either warranted by the patient or initiated by the investigator. By monitoring the following investigation at baseline, after 1 week, and at the termination of the study. A physical examination including vitals will be performed at the start of the baseline period and at each visit. Additional routine laboratory safety tests like hemogram, HbTLC, and biochemical examination like hepatic and renal function, USG abdomen will be performed whenever required. All adverse reaction resulting from the administered drug will be meticulously documented and reported to both institutional ethical committee and the pharmacovigilance and patient compliance unit at GTCH Patna. Method of collection of data, method of data collection and interpretation. Collection of data will be involved in a comprehensive approach and computing both objective and subjective parameters. After through screening, diagnosed patient of uncomplicated UTI who fulfill the excluding criteria will be enrolled in the study. 60% will be included in the study after 90 other incidents about the study obtaining their voluntary written consent. They will be allocated randomly into pair B. For the test group and control group respectively by using block randomization method. Test group will have 30 patients and control group have the same number of patients. The test group will be subjected to test drug to be administered tablet form in a dose of 2 tablets, Sharbat 20 ml twice a day, orally for 14 days. Control group will be subjected to a standard control medicine, capsule 9 per time, 100 mg twice a day, orally for 7 days. Patient will be kept in follow every 7 days. The data will be analyzed using appropriate statistics. The safety and efficacy of test drug will be ensured by monitoring the hemogram with ESR, biochemical indicators for kidney and liver function at intervals. And the final effects of the drug during study will be noticed carefully. ये लोग randomization का एक method है, इसको मैं study में follow-up में for baseline to 14 days of treatment. Urine analysis with microscopic evaluation of bacteria and bacteria and RBC. Urine culture and sensitivity tests. इस चार्ट में जो लैब इन्वेस्टिगेशन है उसको बेसलाइन पे डे 17 पे डे 14 पे मेंशन करते हैं. Adverse effect documentation. Any adverse effect of drugs will be documented and reported to the peripheral pharmacovigilance center GTCH and will be recorded and reported to the principal investigator. Informed consent agreement और documentation जो जितना भी documentation है उसको submit करेंगे department में study complete हो जाएगा. The study will be carried out strictly according to guideline of clinical practice, including the principles mentioned in the declaration of health safety. Ethical clearance compliance or clinical trial. Once the ethical clearance is guaranteed, the study will be called registered in clinical trial registry of ICMR. The study will be started after obtaining approval from the IEC and registration in CTRI. आउटकम मेजरमेंट के लिए हम जो ऊपर मेंशन किए सब्जेक्ट ऑब्जेक्टिव पैरामीटर इम्पोर्टेंट देखिए इम्पोर्टेंट को है हमारा आउटकम जो भी आउटकम आएगा उसका रिपोर्ट करेंगे does the entity require any investigation intervention to conduct confession or hormone or animal? Yes. Pre and post investigations में for diagnosis, inclusion, exclusion, and assessment. Hemogram with CSR to rule out infection, blood sugar to rule out diabetes, PDLR to rule out STD, HIV1 to rule out HIV, KMT to rule out chronic renal failure, urine protein and microscopy, and urine culture sensitivity, and ultrasonography to rule out complicated urinary infection. सेफ्टी ऑफिसर के लिए टीटीसी कराने के लिए क्या करते हैं सेफ्टी कराने में जो उसका मेजरमेंट आएगा उसको हर किसी का मेंशन करेंगे चार्ट में ये रूटीन इन्वेस्टिगेशन को देखिए डन बिफोर commencement of the protocol therapy.
Thank you, Dr. Sharma, for your presentation. You have outlined all the literature regarding your synopsis. I think this is not your synopsis. This was communicated.